Carolina Tim is at a clinic in Nalia. She's here to visit her sister who has been hospitalized with malaria, but she's also getting medicine for hiccups. Hiccups? I later asked to make sure I heard right.
Some people take it that, yeah, when you have a hiccup, you drink water. But to me, I was also surprised when doctor told me that no, it's not necessarily that, it's because of my condition.
The condition she has is kidney disease and she can't afford to have any infection, including a hiccup.
One thing what I have really tried to do is to get closer to the doctor so much. That's why I think I've managed to live through these 2 years.
Atim, a mother of two, was diagnosed with kidney disease in 2013. It was news which shattered her dreams.
I had hypertension in pregnancy, which continued. I thought it would end when I gave birth to my second child.
After a persistent heartbeat after birth, she undertook a checkup after recommendation from her physician.
The radiologist discovered that my kidneys were smaller than normal. One was 6 centimeters, the other was about 7, and yet they were saying the normal size is about 9.
Caroline was referred to Dr. Robert Karyesubula, who is amongst the only 4 kidney specialists the country has. He works at the National Referral Hospital, Mulago. He tells me she came to him at the worst stage of the disease.
Current team is actually in stage 5, unfortunately.
I asked him, doctor, how would I go through stage 1, 2, 3 without realizing?
The majority of patients with chronic kidney disease have no symptom at all. So up to 80% of people with kidney disease are walking out there knowing nothing. By the time you get symptoms, it's late.
I was psychologically not fine. I returned home. He gave me some medication on hypertension.
Hypertension is one of the main causes of kidney disease, according to Dr. Karyesubula.
Kidneys, they are small, but they do a great job because they are the ones that get rid of toxins from the body through passing urine. Among other things, they control the blood pressure, they maintain the blood levels, and also maintain bonds by balancing the calciums, and they generally maintain the environment of the body.
Other causes include diabetes, cancer, and infections such as malaria.
Red blood cells, which carry oxygen to the body, can get destroyed, and in that destruction, a lot of toxins accumulate. Some of those toxins actually go and damage the kidney, and that is what is often called black water fever. When malaria causes renal failure, then you are really in trouble.
Tobacco use and alcohol also increase the risk of dying from non-communicable diseases. Even when alcohol does not directly affect the kidney, it increases the risk of heart disease, aggravates diabetic disease, which in turn affects the kidney. Diabetes, which is trigger of kidney disease, is another ailment on the rise in the country. According to WHO, diabetes is amongst the leading causes of kidney failure.
The only solution is to either me to have dialysis, which would be doing it for life, or if not, I go for a kidney transplant.
Both options are too expensive.
The cheapest is actually in Mulago. You need between 80 and 100,000, and that's because the government pays the rest. But the true cost of dialysis is somewhere between 300,000 to 500,000 Ugandan shillings per session.
For this family, since Caroline was diagnosed with kidney disease, it has been one expense after another. For a young couple such as them, they had to put on hold many plans for the future. All the monies have been tuned into health care for Caroline, and that's what kidney disease means: expenditure.
Sometimes when we sit down at home, I always tell people that I think I'm very rich, because if I've managed to keep this kidney disease for this period with my very little salary.
In Mulago Hospital, about 300 people require dialysis, but only 78 are getting it, just because they cannot afford it.
I've seen people sell their plots of land. I've seen people become paupers because of dialysis. Because it is like a business. You have to learn. You are just buying your life.
Unfortunately, those who cannot afford the costly drugs, dialysis, or a kidney transplant, they stare a life of despair, peppered with pain and a slow death. For the first 2 years, Caroline did not use the dialysis.
Since my body is weakening, right now I'm operating at 3% of my kidney function. The doctor advised me to to be prepared for dialysis in case the process is still taking quite long.
What we are trying to do is to skip dialysis and do what is called a preemptive transplant. You get a transplant without having to go to dialysis.
As she waits for the transplant, for which she has to part with about 20,000 US dollars, which is nearly 60 million shillings, Caroline still has a huge bill to pay for drugs.
When I was anemic, I was put on a drug called, it's more or less a hormone, erythropoietin, which is about 120,000 per ampule, and you're going to get like twice every week. Then there's iron sucrose, which is 36,000. You're also getting it about twice every week.
The transplant is to be done at Yashoda Hospital in India.
I went to the media to try to get ways of mobilizing money. Public has supported us.
She's lucky to get a donor. Though her sisters agreed to donate her kidney, not everyone has approved of it.
There's first of all that that kind of stigma put on you by the community.
Out of their ignorance.
Yeah,
actually.
out of their ignorance. They're like, for you people, what? Like one day they told her, why are you bothered with a dead person already?
With a supportive husband at her bedside, she's optimistic about her recovery.
And also took up the roles of taking care of the children.
I must tell you, it was so devastating. It changed everything, how we looked at life. Because when we were assured that the disease would not be reversible, it meant a lot to us.
It has not been very easy for us psychologically. You know, most times you could even be sitting with her, she just sits and she doesn't talk. You try to crack jokes to make everything lively, but sometimes she just shuts off. She doesn't talk, and you know, it affects the children, it affects the husband, it affects us.
Her family continues to give her encouraging words. Earlier this year, after fainting while at Changwale refugee camp in Hoima where she works, her bosses granted her a transfer to Kampala so that she can easily access her doctor. However, sometimes the pain is overwhelming.
In that I've reached a stage of getting used to the pain.
She relies on prayers to overcome depression.
I keep counseling her and telling her that if the world has denied you, at least I'm there for you.
According to nephrologists, kidney disease is easy to avoid.
Adults need to take about 2 to 3 liters per day. It doesn't have to be water, but it can be anything to drink. Then people need to stop smoking. They shouldn't take a lot of alcohol. Importantly, they should eat right. The diet should be without too much fat and without too much protein. And then they should exercise.
Caroline also wants to gain some weight.
I just long to be fat.
You want to be fat? Oh my God, Caroline.
Yeah. You see how small I am. It's so bad.
As long as you're small and
actually, I think it's the being small which even is affecting me psychologically.
So it's actually a lesson to not only to us, but to everyone, that it's always good to go for routine checks.
Populations in Uganda are no longer solely affected by diseases of poverty such as malaria, but also diseases of affluence like diabetes and hypertension which trigger kidney disease. Florence, NTV.